Assalamualaikum, I am Fatehah. In today's presentation, I will share about motor tics. So let's get started. First of all, I will start with the definition. So, motor tics are involuntary movements caused by a spasm-like contractions of muscle, most commonly involving the face, mouth, eyes, head, neck, or shoulders. Tics are often sudden and repetitive, while tics may appear to be intentional, but they are not. In the next slide, I will show you a video illustration on what motor tics really like.
Some of my short and simple tics are I'd blink or I'd roll my eyes to the back of my head. I'd shoulder shrug and I'd move my head, and I'd like kick my leg out. Another tic that I used to have is I'd get my hand and I'd click my knuckles, but they wouldn't need clicking, so I'd push my knuckles down and down, and I'd have all swollen and bruised fingers. It wasn't very nice.
Motor tics and stimming may look very similar, however, in reality, they are much different, as motor tics are commonly involuntary and harder to suppress, while stimming is a repetitive movement which helps people with autism to comfort themselves. And tics are often comes with a strong, uncomfortable, and distressing sensation beforehand, which called premonitory urge, while steaming doesn't usually have premonitory urge beforehand, and it is possible to stop. There are two types of motor tics, simple motor tics and complex motor tics. For simple motor tics, it involves only one muscle group or body part. They are not harmful but can be embarrassing or painful. As for complex motor tics, it can be a combination of many simple motor tics or a series of movements that involve more than one muscle groups. These types of tics can interfere with daily living activity and may be harmful, such as head banging or lip biting. These are some of the symptoms for simple motor tics and complex motor tics. For simple motor tics, it includes quick eye blinks or eye jerks, tongue movement, including sticking out the tongue, head twitches or head jerks, and shoulder shrugs. For complex motor tics, it includes facial grimacing, touching people or things, obscene gesturing, or gyrating movements. A good medical history and a physical examination is usually all that is needed to diagnose a motor tic disorder. The doctor will ask how long the tic has been occurring. If a patient has experienced a tic daily for a year and has not had a tic free period longer than 3 months, the diagnosis is a tic disorder. As for treatment, the approach taken will depend on the individual case. Behavioral therapy is often recommended for both autism and tic disorders in children. Those with severe tics that interfere with activity daily living may be managed with medications that include neuroleptics and other sedatives. Behavioral therapy is a form of cognitive behavior therapy called habit reversal therapy. Therapists will observe the child when they feel the urge that precedes an oncoming tic so they can develop a competing response. For example, learning various breathing exercise and relaxation techniques to decrease tic frequency. In the next slides, I will show you an example of habit reversal therapy on children with tics disorder.
So that's a complex tic because it's got two parts.
Yeah.
But we've got to catch the first part of the tic and work on that. So what I'm going to suggest, and let me try this out, is as soon as you feel the urge around your eye, instead of your eye moving up like this, I want you to very gently cast your eyes down.
Oh.
Just gently. And hold it and hold it and hold it. And it's okay to blink. And not too far down. Let me practice that with you. kind of down to about there, if that makes sense. But remember, you've got to hold it until the urge to do the tick goes away. You're doing a brilliant job now. Is the urge to do the tick still there? Yeah, okay. And I haven't seen the tick come out.
So that is all from me, and thank you for listening.